Hi, my name is Lauren Masi, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about why your hands feel numb or tingle. So numbness or tingling in the hands can have many different causes or origins, but one thing that it does let us know is that it's coming from a nerve. So somewhere a nerve is getting unhappy. That nerve might be getting compressed from inflammation in an area. It might be getting compressed from an actual tangible source. So commonly people think of any numbness and tingling in the hand as being due to carpal tunnel. So carpal tunnel is a little ligament. It's an area in the wrist right here where there's a ligament or a retinaculum that kind of goes over the top of where all of our forearm flexor tendons and a main nerve come into our hand. So in that little area, it's very narrowed. If any of those tendons get inflamed or thickened or the nerve gets irritated, that area can get compressed and you will feel symptoms down into your hand. Over time, sometimes you might even start to feel it backwards up into the forearm a little bit. However, carpal tunnel is not the only thing that can cause numbness and tingling in your hand. There's many other nerves that go into the hand. The next most commonly injured one sits on the other side of your wrist over here. Sometimes that is noticed most in people who are cyclists who might be leaning on their hands, and you lean on that aspect of the pinky side of your palm and you can get numbness and tingling into the pinky finger or ring finger. So it's one of our jobs as a physical therapist to figure out where is this coming from. And again, as a layperson, sometimes you think it has to be just in the hand. We've learned that we have to look farther up the chain because sometimes our bodies can trick us. Other areas that can cause numbness and tingling in the hand can be the elbow, even up here in kind of the neck and front of the chest area through something called thoracic outlet syndrome, or even the cervical nerve roots coming out of your neck. So we're going to help work through all the different tissues, different joints, and different movements to see if we can get to the origin of the pain. We also can do nerve conduction testing to help find the source of your symptoms. So this is a type of testing where we can measure and assess the timing and the speed with which nerves travel down your arm, for example. We can also do it in the lower body, but today we're just talking about wrist and hand. So we can look at it in different segments and really isolate where that compression might be coming from so that we can give the therapist more information to effectively and efficiently treat the pain local to where the problem is. Also, a second portion of that nerve conduction testing, we look at the muscles. We see how the nerves are innervating different muscles because you might end up having weakness due to a nerve compression. And if we do find a slowing or a compression of the nerves, it is crucial that you seek out a medical provider to see what your options are for treatment. One thing that I often tell my patients is if that you start to feel numbness and tingling, when should you see a physical therapist? As soon as you notice it, within a couple days if it's not getting any better. Nerves are the easiest to irritate tissue in the body and take the longest to heal. So if you keep a compressed nerve compressed for too long, you could end up resulting in permanent nerve damage that is not reversible. So we certainly want to help you on the road to figuring out why your hands are feeling numb and tingling. And we can do that through the nerve conduction or EMG testing. Or another diagnostics test that we offer is musculoskeletal ultrasound. It's super cool, just like the ultrasound that you might have had if you had a baby and you were looking in a belly. We can look at the nerves in your hands and wrists and everywhere in your body, but to see if we actually can see where that nerve is inflamed or narrowed and compressed. All of these diagnostic tools together can help the patient give more information to take back to their doctor to see what their options for treatment are, whether we can keep it conservative with physical therapy care, or if there's a compression that we can confirm via the ultrasound and the nerve conduction testing, whether they have to be a surgical candidate. So if you need some help figuring out where your numbness and tingling is coming from in your hands, please reach out to Bay Area Physical Therapy today. And for more information, please reference some of our other vlogs on diagnostics, carpal tunnel, and finding the cause of numbness and pain. Thank you so much.